Hello, 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 everyone. I'm Dr. Kelly OMZ. I'm your board certified OBGYN and healthcare executive here to help you live your healthiest and wealthiest life. The way that we do that is through webinars like Ask Dr. Kelly OMD, which comes on Mondays at 7:30 p.m. Eastern Time, as well as we have a podcast that's called the Viva Life SPF Me Experience. That is published daily, so you can get that on any of your platforms and just put in Viva Life. Lastly, we have something called an affirmation room. And what that is 15 minutes of focused, positive energy so that you can figure out what do I need to let go of, and then what do I need to call forth and affirm, as well as be grateful for. Those 15 minutes are the most powerful time of your month, I promise you. But that being said, I have nurse practitioner Alexis here. She is going to talk to us about fear versus empowerment. NP Alexis, introduce yourself and tell us the three things you want us to take away tonight.
All right. Good evening, everyone. Viva Life community. It's such an honor to be here with you all this evening, to be with you virtually and share a bit about a topic that's close to me, fear versus empowerment. My background as a nurse practitioner is in hair restoration and primary care. My experiences in life have shown me how fear can be limiting and how it can keep me from limiting or experiencing my fullest potential. Today, it's my goal for you to understand what fear is, where it comes from, how it manifests in our day-to-day life. And we'll look at a couple of psychological theories that helps us look at the cognitions of empowerment and see how we can implement practical tools to get to that point. At the end, we're totally open for questions, but I would love to hear your experiences on how you've experienced fear and things that you've been implementing to get yourself to a place of empowerment as well.
Well, I'm excited. And like I said earlier, I know that this is going to be amazing. So, NP Alexis, take it away.
All right. Thank you so much, Dr. Kelly. So we'll start off with defining fear. We've all experienced in our life some aspect of fear. So the American Psychological Association defines it as an emotion that's detected after like an imminent threat. Our body responds by producing a rapid heartbeat, tensing up of our muscles, taking action. This is also called the fight or flight response. We have two different types of fears. We have natural fears and we have conditioned fears. Natural, like I was noting, is just that imminent response. So our amygdala, as well as our hypothalamus, triggers the stress responses. It gets our body ready to take action, basically. So you may have experienced or seen someone like respond to seeing like an animal, like a wild animal. That's an example of a natural fear. Our body's going to protect us and get us out of that situation. We also have conditioned fears. So this is the opposite of a natural fear, where it's developed through our learning experiences. We've either had some kind of experience or we are able to associate our feelings based on something that's negative to us. This may be like you're chased by a dog as a child, and so now when you see a dog or you think of a dog, you have that stress response that comes on up for us. I think what's important to note about the conditioned fears is it shows that our brain has the ability to change over time. When we think about phobias and overcoming phobias, we utilize conditioning to overcome it. So our brain has that powerful ability to change. So what fear is not? Fear is not anxiety, or basic fear is not anxiety, and basic fear is not a phobia. If we don't handle or take care of fears that we experience, they can end up manifesting as anxiety or a phobia. So anxiety is a response to an emotion that we feel that's, in a sense, future-oriented, and it's a long-term response to that particular threat. Phobia, on the other hand, is when we have, in a sense, an inappropriate response to a fear. So let's say you're going to the dentist, you've gone to the dentist in the past, you had a negative experience with the dentist, and at this point, you avoid the dentist at all costs, to the point where you're not even going and pursuing your routine checkups. So at this point, that fear is a phobia, and it's keeping you and inhibiting you from doing routine care that's important for what you need. So aside from those two examples, it's likely that the fear that we experience isn't often physical. It's more psychological and emotional, social aspects of fear. These may include worrying about the future, financial stability or instability, interpersonal relationships, fear of failure, or even rejection. It's an appropriate response to feel this way about those things. We just have to make sure that they don't manifest, like I said, into an anxiety and keep us from manifesting into the fullest potential that we can accomplish. So as I said, our body can allow us to just react in a natural way, and in a sense, we can look at our cortisol response. So aside from not reaching our full potential, stress and anxiety and fear can manifest in a way that's harmful for our bodies. With the increased cortisol, that can have a negative impact on our cardiovascular system, impact our ability to regulate even our insulin, and even impair our immune system. So now we're going to switch over to talking about empowerment, and we're going to look at the 4 different cognitions that encompass it, which will then allow us to look at a couple of psychological theories and see where we can implement changes to become and feel more empowered together. So empowerment is the promotion of skills, knowledge, and confidence necessary to take greater control of our life. When we feel empowered, we're more active in meeting the needs and fulfilling our desires. We even have a sense of achievement and realization of our own abilities and our ambitions. So as I noted, we have 4 different components of empowerment. We have meaning, we have competence, self-determination, and impact. Meaning is basically finding purpose in what you do, in the things that you do. It's often connected to your beliefs, your values, and even your behaviors. We have competence, which is related directly to self-efficacy. And for those that are unfamiliar with self-efficacy, it's just your beliefs in being able to have the capacity to complete a particular goal. Last 2, we have self-determination and we have impact. So we want to have a sense of choice in initiating and completing things for ourselves. And we want to feel as though we do have the actual ability to impact what it is that we need to do for ourselves. So in looking at the 4 cognition, there's 3 psychological theories that have stood out to me, and we'll go over or aspects of those theories that allow us to feel more empowered. First off is the social cognitive theory. If you have a background in psychology, you've likely heard about it before. It really emphasizes self-efficacy. So we need to be able to shape our experiences or utilize our past experience to shape and model who we are in the decisions that we make. It's said that those with high self-efficacy are obviously able to persevere and obtain challenges and overcome the obstacles that are in their way. We can improve our self-efficacy by mastering experiences. So even like breaking down smaller experiences to build our confidence up to overcome larger ones. We can utilize visualization to increase our self-efficacy, seeing ourselves complete the task, seeing ourselves become more successful, positive self-talk through affirmations, things of that sort, learning from our failures, seeking feedback, and even having a very supportive community around us. In addition to the social cognitive theory, we have the self-determination theory. This takes a look at cognitive principles of competence, self-determination, and impact, where it basically notes that if our core psychological needs are met, we are going to be more successful and rely on an intrinsic motivation rather than external rewards. So those 3 basic psychological needs are autonomy, so our independence, our freedom, competence, which we've touched on just a bit already, and then relatedness, so bringing it back to that sense of community. I've seen in my life that when I feel aligned, when I feel like I have, A through Z together, I'm less likely to determine my success or who I am in this world off of external things, when my bases are met. So when we look at a couple of the tools, I want you guys to remember, okay, when our basic needs are met, and I know that's something with Viva Life you all practice and implement all the time. So it's the core. You're going to feel more successful and more empowered. And then lastly, we have the positive psychology theory that basically says that when we focus on our well-being and we focus on the positive psychology of things, we are overall happier and in a position to live a better life. An aspect of positive psychology that I find beneficial in my life is the ability to practice gratitude and mindfulness, and also to take a look and assess what my personal strengths are. So after looking at those psychological theories, a good set of tools that we can implement throughout our day-to-day are journaling, vision boards, gratitude practices, goal setting, utilizing even goal-setting apps, the mindfulness exercises, affirmations, and opportunities to just practice overall self-compassion. When we utilize those and understand that self-empowerment is indeed a journey, we are less hard on ourselves, and we can really give ourselves grace and realize that this isn't something that we should accomplish in a week. Our goals and structures that we have can change the next month, a couple of years. And it's important that we consistently do that reevaluation of where we are and evaluate those fears, look at the core, and understand where we are and what tools we need to implement to feel more empowered as we work through them. So very short for me today. That's the overall gist of what I'd like to talk about. I would love to hear what questions you all have, but most importantly, what tools are you all already implementing? What tools would you suggest for someone else? I really want to make it collaborative between us.
Well, first of all, thank you, thank you, thank you. And Viva Lifers and our guests, we know that you are already ready, because one of our things here is we're always ready. But I just want to say thank you. I mean, what you said, I think is just a, reinforcement of what we do. So they should be really ready to converse with you in regards to what they're doing in order to enact some of these things to decrease the fear so that they can feel more empowered. So Viva Lifers, if you have a question or if you have a comment, go ahead and either type it in the chat or raise your hand and we will get to you. As I'm waiting for that, I do want to ask the question about, you mentioned cortisol. And you mentioned the effects that cortisol have on the body. And I just want to say that, we all live at this like basic elevated amount of cortisol because we have these like basic stressors. But if you could tell us a little bit more about how cortisol affects our body, our nutrition, our physiologic milieu, that would be helpful.
Yes. So that, like you've noted, we do have a baseline of what's normal for our body to function well. It's when we aren't able to correctly process the cortisol that it wreaks havoc. So whether it be the cardiovascular system, our immune system, when we have too much, in a sense, sugar or the stress hormone in our body, it can limit how our body is able to function appropriately, is the overall gist. We may see increased blood pressure. Like I said, our immune system may weaken. It can be very variable of how we respond to the excess stress. But what's important is understanding how it can manifest in a way that we can see. It may be our digestive system may not be on track. We may fall ill more frequently. We may see, again, that high blood pressure taking effect. We may see that it's harder to lose weight, or it's harder to maintain a certain sleep schedule. We want to make sure that we are assessing how is our day to day, and not necessarily attributing it straight to the cortisol, but attacking the things that we can change before seeking or doing that in addition to seeking medical attention for it.
Absolutely. I love that. I love that. Thank you so much. All right, Viva Lifers, go ahead and ante up. We have no fearful people in this room right now. So go ahead and ante up some of the questions that you have for us. One of the things that you mentioned, I'm just going to keep going and asking until they bring something forward. But a couple of things you mentioned is the journaling and the vision boarding. What do you recommend for people that have not journaled or have a hard time being consistent with journaling, as well as vision boarding?
Yeah, so I will totally say that that's not one of my strengths. Thankfully, there are tons of apps that can link journaling into a daily practice. Or one that I've actually tried is like a coloring page for your iPad, and at the end you can say, okay, how did I feel as I colored this? I wouldn't have thought of that either. There's also apps called Calm that, in a sense, journal for you. As soon as you open the app, it asks you to assess how you're feeling. How are you feeling today? And you can see a log of that over time. With a lot of things, I say take small steps. Maybe it's your goal to journal once a week, once a month. You just check in with yourself at your month, but I would tie it to something that you naturally do. If you love going to the beach, if you love, spending time with God in the morning, associate it with something that you already are doing, and you'll be a lot more likely to stick with it.
Love that as well. And then, as you know, Viva Lifers who are a part of the Viva Life experiences, we do journal. We encourage journaling pretty much every day, even if it's one sentence that you write down when you wake up in the morning before you go to sleep or sometime during the day. Vision boarding, we try to do that at least once a year, and bringing in that second part of the year so that 6 months later, so you can see exactly the progress that you have made on your vision board. Because as they say, if you don't know where you're going, where are you going to get? Where are you going to go? So the vision boarding actually helps as well. Now you do something else that's really amazing. You're a spin instructor, right?
Yes.
So tell us about how, spin helps you manage your daily life.
Yes, I would even say that spin has allowed me to overcome aspects of fear that I have for myself. That is my tangible example. I definitely have had anxiety with speaking in front of others, anxiety and issues in my own self-confidence. And spin has challenged me to literally face it every single week. And it's something that doesn't go away, but it allows me to feel my empowerment through the action of overcoming my fear. But yeah, so like when taking on a larger task, when looking at, okay, how am I going to address this particular aspect about who I am that I'd like to change, I would say find a hobby, find something that you love to do. I love music. I love moving my body. I love inspiring others through movement and music. And this has been the perfect way for me to improve aspects of myself, but also give back. So when I'm looking at myself as a whole, I'm constantly improving. I'm constantly overcoming challenges through spin, and I'm seeing it manifest in my life.
I love that. And I absolutely love spin. Now the seat is a little thing for me.
It is.
That's why, Peloton became so popular, is because a lot of people
Yes.
actually spin and have it in your home. And then with all of the music and the personalities that go along with it, I'm sure your spin class is just as amazing. So we have a comment in the chat. There's been a lot of discussion on the downside of excessive positive psychology. I can't think of the term I've heard used, but too much positive self-talk become unhealthy?
I believe too much of anything can be a negative. When we take a look at positive psychology or the positive psychology theory, again, it's the focus of, we're going to look at all the good and focus on the positive things. And in a sense, I don't want to say ignore the bad that's happening, but it can be interpreted as that. I do think that it's not the only way to look at our stresses or our only way to look at our fears. We do need to understand that we have real problems. We can't fix everything with positive self-talk. That's not realistic. That's why we have individuals who dedicate professions to medicating and using talk therapy and helping patients through different situations. There's a reason it's necessary. I think it's beautiful in combination with other modalities, and not to say that traditional therapy is the only answer as well. There's patients that need medication for anxiety. Every situation is different. Every individual is different, and I'm a true advocate for patient-centered care, looking at the patient as a holistic person, but individualizing that care that's specific for them is incredibly important.
Thank you for that great question and that great answer. I know that for the most part, I'm a very optimistic person, and I tell my Viva Lifers all the time. And so, guess you will now know this. So, I'm the type of person that has many therapists. I have coaches, I have therapists, not too many, just enough so that I can manage these different fears or anxieties and overcome challenges. But I do find that, yes, we have to have a balance, but I see that in this world and externally and sometimes internally, there's more negative thoughts than there are positive thoughts. So it's almost hard to, overcome that negative thinking and that negative environment. Um, but I also know that, when we do our meditation and journaling, we're always trying to say, what am I trying to forgive and release? Like, what is negative around me that I'm trying to acknowledge and let go of so that I can affirm something positive coming into my life, so that I can be grateful for what is actually going on in my life as well, and the blessings, or the achievements or successes that we've had. So not disregarding anything that's
Mm.
negative, being able to acknowledge that, but we're also able to see that and talk about it in okay, how do we change this into a positive thought, or how do we navigate this so that it can be a positive outcome for us and have a success associated with that. If you as a primary care provider, someone is coming into the clinic and you said, what, let's talk about what we could do to switch the negative talk into empowering talk, to build your confidence, to help you see the other side or get through this difficult challenge.
So when someone's coming to me, I would definitely make the distinction between are there some psychological issues that we need to address, and I would do that through screening. But if I find that they are not flagging in the screening tools that I utilize, I would talk about some of the journaling, the self-affirmation. I would find and really assess what do they naturally like to do. So I would say, when are you the happiest? What do you like to do? If it's like, I love playing pickleball, I would say, let's work on finding community in pickleball. Let's work on doing things and understanding why is it that you feel empowered and feel successful in pickleball. And they're like, well, I love to win. I love when I receive positive feedback from my teammates. Okay, I'm like, well, let's do more team. Let's incorporate that more in your life. Let's look at other activities that make you feel a part of community and make you feel as though you're giving back or you're succeeding and doing things that continue to challenge you. So that's kind of where I would go there.
Yeah, I think that's really important. It's funny you mentioned pickleball because I was actually at the YMCA today, and there was like 40 people, like sets of people
Yeah,
out the pickleball, and I'm thinking to myself, I don't even know how to play this game. I mean, it looks like tennis, but a shorter court. So I was like, I need to learn how to play pickleball because this is where all the people are at. And I can
yeah.
imagine, just for example, when you're talking about self-empowerment, when we are doing a form of exercise that we enjoy, that
Mm.
we are, we have our endorphins, they're coming up higher, which is going to give us more positive energy and confidence in ourselves. And as you learn the game and get better at the game, then you're like strategically thinking and you're moving your body, and all of those things are going to help you live a healthier lifestyle. So let's see.
Yes.
We have the comment, self-empowerment is a process. Can you speak a little bit more about what that looks like for those not open to journaling or mindfulness techniques? That's a great question
That
and
is a
comment,
big,
because that is a big challenge.
yes. I would look at focusing back in on the self-determination theory, back to those basic needs of self-autonomy, competence, and relatedness, where you find a sense of who you are in things that are not external. So you're focusing on your personal relationships, your ability to do things. So maybe you're like, I'm gonna cook daily, or I'm gonna learn a new recipe. Finding success and finding competence in that particular skill. And again, with autonomy, feeling that freedom to choose to do particular things. So trying new hobbies, trying new tasks, things of that sort. So looking to the self-determination theory. I would also, I know it goes back into, journaling, but I would take note of what have you succeeded at? What things are limiting for you, and finding the bridge between those things. So doing like a self-assessment in a sense, where you are, I know it's still along the lines of journaling, but you're writing down tangibly, and you can see what it is that I am doing well in my life. What am I looking to continue, or what do I still need to grow in? And finding that gap there between how do I get from what I do well to where I can still grow.
Yeah, I think you
I
make
hope
some.
that.
I think you make some great points, because a lot of people don't like to journal, or maybe have fears about it. When you have to
Yep.
write down about what exactly is going on inside of you, that can be a fear, that can be a source of fear as well, because then you gotta think. And a lot of times people don't take the time to slow down and really think about
Yeah.
themselves. That also being said, I think that there's ways to verbalize what is going on that will help you as well. So if you wanted to speak into a phone or something like that, professionally, if there are classes that you can take or
Yeah.
courses take that allow you to build your confidence in whatever area that you're in so you feel more comfortable. I think that's a way as well. So let's see. We got another comment as well. So thank you, CT, for asking about self-empowerment. And hopefully that helps you with the process. It's important for people on the self-care journey to find activities and things that fuel them and giving attention daily to mind, body, and spiritual activities.
Yeah.
Absolutely. And I'll say, you probably see this when you're taking care of patients as well. The that statement, I don't have enough time for
Right.
myself. They don't add the for
And it's
myself, but it's like, I don't have enough time. So in the last 30 seconds, if you want to speak to how to make time for you.
make time for you. It's easier said than done, but I always love to inform patients and remind them that your greatest investment is yourself. Movement is medicine. You are a priority. You can't fill from an empty cup in a sense. So as the note was saying, you have to do those daily self-care practices, the daily spiritual practices even, that make you feel the most empowered, that make you feel the most prepared to react and adapt to the things that you have in your life, so those around you can experience the best you. It's hard. It does take time, but just finding those areas in your schedule where, you know what, I'm going to choose me for 5 minutes. I'm going to choose me for the first 5 minutes of my day and spend time with me. I'm going to do this for me. You choose me over and over and over again. And over time, you'll develop that habit, that sense of purpose with finding and choosing you. And you'll fall in love with it.
I love it. You're going to fall in love with yourself. And that's what we
Yeah.
need, because that's how you make a positive impact, not only in your life and others' lives. Well, nurse practitioner Alexis, we just want to say thank you, thank you, thank you for talking about this subject in such detail and giving us powerful, impactful action items that we can do. Is there anything that you would like to close with? And if I could just ask you, what is your favorite motivational I am statement?
I am capable. I'm capable. That's something I tell myself always. But it's also a pleasure to be here with you all. Thank you for giving me the space to talk about something that I work through daily, something that I love, choosing things that allow me to be the best version of me. And I hope that you all take that away too.
Well, thank you so much. And I'm Dr. Kelly, OMD, like I said, board certified OBGYN and healthcare executive. If you'd like to reach out to us, please go to at Dr. Kelly OMD on Instagram, as well as our website is drkellyomd.com. We encourage everybody to join our Viva Life experiences. There's 3 different levels that you can be a part of. We will help you improve and change your life for the better. Have a wonderful evening, everyone. And don't forget to do what? Viva Life. All right, all right. Thank you for being a part of the Viva Life experience. I'm Dr. Kelly OMD, board certified OBGYN and healthcare executive. If you like what you heard, then please go ahead and like, share, and subscribe. The reason why is because we are trying to educate, encourage, and inspire 1 million people to live their healthiest and wealthiest life. And this is what we're bringing you. We're bringing you educational videos. We're bringing you podcasts. We are bringing you webinars with subject matter experts, including myself, about the topics that affect you the most. So go ahead, like, subscribe, and share. We are everywhere. Have a wonderful day. Viva Life.